The DFF, it's a reform. There's a Health Sector Strategic Plan 3, and it was launched together with the Health Financing Framework. So within that, there is a recommendation that health facilities, should be able to become autonomous. They should be able to finance their own activities. So the initial works before that reform was out, initial piloting was done in Rumpi. And I think in Rumpi, facilities would get as little as 1 million for the whole year. But it was still seen to be very effective, because from there, the facilities were able to lobby for more funding. They were able to get more than the million seed money that they had received. So seeing the effectiveness in Rumpi, the Malawi government decided that this now should be a reform, and it should be taken on board across districts in Malawi. As of now, the DFF is being implemented in 13 districts, but Blantyre was the first district that started the initiative, and it was with funding from Partners in Health. We are pumping in $100,000 to Blantyre DHO, and it has supported a lot of activities.
We are very grateful to be considered as one of the pilot districts for this project on direct health facility financing. And we are very grateful to all our partners that have actually enabled us to be able to carry out this project. So far we have actually able to start this project in about 13 of our facilities in the district. We actually picked out the facilities based on their location. As you know, that Blantyre is a city, but also has got rural areas. So some of them belong to Blantyre rural, some of them are in Blantyre peri-urban, others are in Blantyre city. And so far the results are quite encouraging. We are actually encouraged, especially from the fact that the community seems to be very excited about the project. And they feel that they have been empowered to take matters in their own hands in as far as running of health services is concerned in the health facilities that actually serve them in their own communities. Because previously we used to run all the activities centrally through the district commissioner's office or the district council. So if there was a problem at a health center, it means that we had to actually coordinate the activities from the district. And this could be challenging because of distance in other aspects, but also the procedures and protocol that are involved in, for example, procuring of items and so on and so forth. And that was actually causing unnecessary delays in the implementation of the activities.
When we came to Blantyre, the health center management committees were not functional, but the DFF works, it's a community empowerment initiative. Therefore, you need a functional HCMC. So we've trained the HCMC. We have started from reconstitution, training them on their HCMC roles, training them on DFF, and we continue up to date to support them with monitoring and evaluation activities, mentorship activities, supportive supervision, together with the DHO. So we have allowed the DHO to take lead. We just come in to support them, because we know that this is an initiative that has to be sustained. Therefore, we have to allow the DHMT, the facilities, to take lead.
Titapita kumaphunziro okhudzana ndi ndalama zimenezi za DFF. Ndi pamene tinaona nena kuti tili mchitsogolo tsopano chodzipangira tokha mwa umwini mavuto amene tingapeze pa chipatala ang'onoang'ono. Ndipono tikunena pano tapeza zinthu pamene akutiuza nena kuti tikufuna tikupatseni umwini. Ife ndalama zimenezi sizoti tidzitenga kukugulirani katundu, koma inuyo mudzidzigulira nokha.
Tiyamikire kuti kwakukulu kumene ndi momwe fandi inabwerera tayesesa ndithu kuchitako bwino. Ngati gawo loyamba limene tachita limene monga mapulani athu tinayerekezera malingana ndi fandi momwe inabwerera, ndiye tinapanga trim mapulani athu kunena kuti I think tiyambe ma department ena pang'ono ndi pang'ono. Kumaternity chimene takonza ndi malingana ndi fandi imene anatipasa, poti kumafunikanso zambiri pa chipatala panopo. Kumaternity tagulako sopo monga amafunikira sopo, komanso kureba kwathu kunasoyekera kuti tingapange bwanji kuti anthu asamaonera neti ngati kuti wina aliyense akhale mobisika. Tinagula makatani, takhomesa matabwa, tayikaso matabwa amenewo. Komanso masache zikolopa zofunika pa chipatala panopo.
Ntchito imeneyi ife ngati kudera tidayilanda ndi manja awiri. Mwina ate matha kusowekera mwina bibi machine chomwenso mwina mabatiri amene kuti madokotala athagwire ntchito kumalephera. Komanso mwina tenda nanu muonamo muzitseko zina kuti ntchito idakalipo ndithu komano kusintha kulipo kuchokera mu DFF kalimeta ndirayi. So that ifeyo tikukondwa kwambiri fa zinthu zina zimakhala ife zikutivuta foti ife tibe ndalama ngati kuno kumudzi. Ndalama iyi ikutithandizira kumachotsa zinthu zoonongeka kumekapo zinthu zabwino.
The DFF is also given us the opportunity to be working with the community. We have the committee, the HCMC. Before doing any buying of anything, we move around with the HCMC members, the community members who are in the HCMC. We go through the facility and we look at all the problems that we have, and then we sit down, start to prioritize all the challenges that we have. So when we are doing the buying, so they know how much we have received, they know how much we have used. If we have any funds remaining, they also know that, and they are together with us when we are going to look for quotations as well as to doing the buying. So they know everything. It's more of an issue of transparency. So I think it's improving our working relationship between us and the community. Because apart from them being with us to purchase the things, they also go out there to inform everyone, including the chiefs, of what is being done at the hospital. So it has improved the relationship that we have with the community.
The philosophy behind this is that the facilities should be able to actually engage some local contractors within their communities that can actually come in and support them in some of the minor issues that they might actually need to be supported with at the facilities. In so doing, would actually cut the turnaround time for the entire activity, but also promote efficiency and effectiveness in terms of the response. But most importantly, to get the community to be more engaged and more interested in what is happening at their health facilities, so that they can actually own their facilities as well as the services that are being offered to them.
The facilities are performing maybe beyond the expectations. Many people doubted that facilities, HCMCs, could be able to handle finances. But as you've seen around the facilities, they have taken pride. The facilities, the community members, they have taken pride in the initiative, and they are looking forward to doing more. For instance, look, Sochi Maternity, for example. It's Sochi Maternity, but they don't provide maternity services because the maternity unit was closed. They did not have water. But through direct facility financing, they have been able to access gravitational fed water system. And now, as you've seen, the facility now has water.
At this facility, we have been having challenges to maintain IP, to maintain hand washing, to maintain all things that are connected to water. But with the coming in of DFF, we have managed to source water from our nearest mountain, Sochi Mountain, of which it is supplying us water at the facility. Now we are happy because we can now maintain cleanliness of our hospital and the IPC and the other things.
As you've seen, Sochi Maternity, it's on a hill. And you can imagine moving all the way from there to go to the nearest health center, which is Limbe Health Center, the struggle. So direct facility financing, like, it's giving those results that we didn't even expect. Bangwe has stayed for a year without water. With DFF, the community has managed to renovate, to maintain their borehole.
In terms of minor maintenance, so far amene idapanga ngati pa chipatala takonza njigo, tinagula zipangizo zoti tikonzere njigo omwe wakhala almost a year usakutulutsa madzi. nde pano pataukonza mjigo umenewu kupyolera mu ndalama za DFF pano pa mjigo wathu kutuluka madzi bwinobwino. Komanso china tinali ndi mene anzathu amatha kuperekera makhololo ngati mkhofu bufi. Khofu bufi imeneyo inali malo onena kuti anthu ena makanika kuti amasuke bwinobwino apereke makhololo. Takwanitsanso kupyolera mu ndalama zimenezizi kuyisamutsa kuyipitisa malo amene mapeshenti athu anga makhale omasuka operekera chani kupereka makhololo. Komanso tinali ndi vuto la madzi pamita pathu panalibe nani retaining valve yomwe imathandiza kuti madzi asamathenso kubwerera kumita. Tagulaso chimenecho ndipo tinakayika pamita pathu. Tagula stationary iyo tizigwirisira ntchito tikamakumana ngati Health Center Management Committee. Komanso tagula ma cleaning material zipangizo zina zomwe zingathe kutithandizira kuti tizigwirisa ntchito pamene tikugwira ntchito zosiyanasiyana pa chipatala pano, ngati masopo, nkhani ya ukhondo kuti zikhala yoyenda bwinobwino. Tagula masopo osambira m'manja, masopo ochapira ndoti ma beddings ama patient azitha kuchapidwa bwinobwino. Komanso tagula zipangizo ngati matsache, zikolopa. Timakhala ndi ma challenges oti zikolopa zomwe timalandira nthawi zina zimakhala zochepa, nde apapa takwanitsa kugula zikolopa zokuti zitha kutipanga kata for miyezi 3. Tagulaso zinthu zina za magetsi like masoketi ena ndi ena komanso mababu anawonongeka mwina ni mwina sumawala bwinobwino, ndiye takwanisaso kugula zinthu ngati zimenezozo za magesi. Ndiye chifukwa yoti ndi mmodzi wa ma staff a maintenance watithandiziraso kuyika zipangizo ngati zimenezo.
So I would say there's a lot. Look at Ndek. You know that area has got a lot of bats and it always like affect infection prevention issues. They have managed to put a ceiling in labor ward.
We are very happy to have this program. To be honest, it is a very important program because we are managing ourselves to buy some of the things which used to take a long time. So we are having a very good time at this moment due to this program. We identified a problem at our maternity room, especially labor ward. We had a ceiling which needed to be renovated. So it has been there for a very long time. So we had to sit down as a facility management and with people that are working with us, people from community, we call them Health Center Management Committee. So we had to discuss about the way forward using the money. So we had to renovate the room. Now it is a changed room, a very nice room. We are at Ndeka here. We have a challenge of births. So we used to have an uncomfortable room for women who are at labor ward. So for the meantime, the challenge has been solved. So we are very grateful for the program.
So moving around, we are already able to see that the DFF, even though it's not much, but it's already able to give good results. And even though we somehow doubted the capability of the health facility teams, the HCMCs to be able to coordinate the funding, you can see they are able to do all those procurement processes, they're able to do all those financial processes. And actually I was overwhelmed, I was overjoyed with the results that we've seen in the facilities so far.
We are so happy with the coming in of the DFF project here at Neno Community Hospital because it has so far helped us in several ways. So we have only received the first part of the funding, which is meant to cover us for the first quarter, like 3 months. So we started by prioritizing all the items that were on the facility implementation plan. So we targeted areas of infection prevention and control. So we bought items to do with cleaning the ground as well as the inside floors and walls. And we also bought some maintenance items, electrical, like the floodlight, because we had some sections of the facility which seemed more dark in the night. And we also bought some bulbs to use in some of the rooms because they were too dark, especially when it's cloudy. So we are so happy for the project, and we've already started enjoying the benefits of us being part of the facilities that are benefiting in the DFF project.
DFF, it has the capacity to improve the healthcare system. When one is sitting at the, say, district health office, they wouldn't know that at a health center X, today they sent back a patient because they couldn't buy batteries. The funding that goes to the DHO is not enough. The funding that trickles down to the health centers is not enough. But if we support the facilities as well directly through their facility implementation plans, I'm hopeful that we can improve the healthcare service delivery, we can improve the quality of the services, we can improve infrastructure. It's capable of doing that.
So in comparison, the challenge that we have generally with the old system is that there are some activities that happen here at the facility which are not known at the DHO office. For example, we have some well-wishers who come in to assist as well as donate things. Mostly we have churches like the Seventh Day, the CCAP, the Catholic, the Charismatic. They may come and say, we want to help you clean up one of the blocks at the facility. So when they do come, they may also come with the other items like buckets and mops. Now, when you are looking for the other items that have not been donated by the well-wishers within the community, and you go to the DHO, you will find that the other items like hose are still stocked out at the DHO, but they have mops, which you already have. Now, that's where the problem is. So you will be getting something that you don't really need at that moment. But with this, we are able to prioritize. Say, for example, if we have funding that is coming in today, and we had a group from one of the denominations within the catchment area who had already donated that item, we are not going to buy it because we already know that we have this. So we are going now to prioritize other items that are needed and can be used for the facility for the benefit of the community.
So mostly there were issues to do with infrastructural maintenance. Usually a window was broken down, a socket has burned off, and then the machine cannot work in the maternity. Maybe a door handle has broken off, some iron sheets have become loose, and usually it takes too long for us to actually to respond to some of these minor issues, and then because of that time involved, they become major issues. Okay, you started off with like 2 iron sheets being affected, and before you know it, the entire roof is gone for the facility. So we're talking about preventive maintenance, timely maintenance. Mostly these are the issues. Some other minor issues like, procurement of brooms for sweeping the open grounds, okay? There is no need that we should actually be procuring such kind of thing at the district commissioner's office, okay? They can source the brooms locally and have a local provider to actually provide the brooms for them so that they can actually use things like mops. They can actually source those things locally, okay? They can find a local carpenter to help them with 1 or 2 things at the facility. A dripping tap, okay, that will actually cost maybe 4,000 kwacha to maintain because they just have got to replace the rubber that has actually worn out. But it means if that issue has to be handled by this office, we've got to provide transportation to a maintenance officer from this office, okay, to whatever facility is there, whether it's 40 kilometers, 60 kilometers from the office, to and from. That's a driver, that's a government vehicle, that's fuel to fix something that actually can cost 4,000 kwacha. So this money is there to actually, avoid such kind of unnecessary expenses. So they can actually look for a local plumber within the community who can come and fix the tap at a very cheaper price. So we are looking at these kind of minor maintenance issues as well as preventive maintenance that should actually enable the effective delivery of services, and that the services should not actually be disrupted because of long periods of time that are taken for things to be fixed, but also because of government red tape in following some of the procurement procurement procedures that are there.
There are still a lot of projects which we are looking forward towards this DFF. For example, at our OPD, at a waiting bay. Our waiting bay is not that good. Mainly the floor is not in good condition. So we were thinking that in the next quarter, maybe we'll have that chance of maintaining the OPD waiting bay and the other minor maintenance like windows and door locks, they are also not in good condition. So we are thinking of maintaining those areas.
We have a number of projects that we are intended to do. For instance, we are planning to renovate doors and renovate some toilets, and we're also planning to have some stationery as a facility. So we are looking forward to all those things using this project, DFF.
I would like to say thank you very much to Partners in Health for this initiative. We are really enjoying, I mean, this is just the first part of the payment that we have received, and we are looking forward to several other projects that are going to help us at the facility. For example, we were discussing in our last meeting that what we need most at the moment is a backup for water, because we usually have dry taps from our main pipe system there from the Blantyre Water Board. So we need to buy a water tank to store water. So we are enjoying this because of this project that Partners in Health has initiated. So it's just our plea to them as well as to the government to say we don't want this to just be to just be a project which is going to last a very short time. We wanted if this could be a project that is going to last forever. Apart from that, because we are enjoying this project, we are also requesting if it's possible for the project to be extended to all the other facilities so that they can also benefit in as much as we are benefiting as well.
To our partner, we are really very happy for your funding to Social Maternity, and we really appreciate the good job you've started.
Ineyo ndingoyamikira koposa partner wathu amene mwalola kuononga ndalama zochuluka kuzipatala zimene zilipo komanso chipatala chachileka. Tere ineyo langa ndi pempho kunena kuti no ambuye akudaliseni akupatseni moyo wautali kuti mupitirize kupereka zithandizo mmadera mwina komanso pakwathu pano chifukwa tili ndi zosowa zambiri.
Tikuyamika kwambiri chifukwa mwina zina zikutipepukira chifukwa choti tikupanga tokha ngati abwenzi anatilowerera kuti Alund Health Center akuyenera kukhala abwenzi awo. Choncho kusogolo kuno kutakhala kuna kuti kulizo kuti athe kutithandizabe asatisiyebe ife tilimbikira kuchita bwino kuti abwenziwo tikhale nawo.
Abwenzi kuza umoyo muthandizo mina tipatsa ife kwa ife nkhate kumodzi ndipo kondo kwambiri ngati nkotheka munaso atatha kupitiriza mina kuganizira ife tidzanda ndi manja withandizo limene.
We appreciate how we work with the Partners in Health. They have been so supportive to health facilities. So I would love if they continue doing so and reach out to other districts that are still not having this DFF, because it is a very productive program.
Uthenga wanga ndothokoza Partners in Health chifukwa cha ganizo limeneli. Ganizo limeneli lipindulira mapatient komanso ife ma staff. Chifukwa nthawi zina tikamagwira ntchito timagwira ntchito mophinjika chifukwa chonena kuti zipangizo zina timakhoti tilibe. Ndeti mapezeka kuti tugwira ntchito mwina tuganizira kuti tinakhala ndi chipangizo chakuti mwina patient tinakamuthandiza bwinobwino koma ifoti chipangizo chimenecho tilibe patient timapezeka tukanika kumuthandiza. Nde kubwera kwa project imeneyi kuona kuti ndi ndaliso kwa ife anthu aku Blantyre kuno amene tasankhidwa kuti tizilandira ndalama zimenezi.
To all the stakeholders, we are very grateful, and we would like to appeal to them to actually support the initiative, because we feel that it's very important, and it's going to actually improve service delivery as a whole. Most importantly, our plea goes to the communities, which are our most important stakeholders. They need to take ownership of this project. They need to take ownership, full control of the facilities, and be interested in what is happening there. we expect them to actually abide by all the regulations that have been set and make sure that there is prudent utilization of these resources, because that is the only way that we can effectively and efficiently provide good quality services to the community at large.
And also through the DFF, there is a potential that we could do big things. DFF, look at our neighboring country, Tanzania. Now they are able, a facility is able to give a contract to healthcare workers to work at their facility because they identified that the reason why they are getting poor services was because they had inadequate healthcare workers. But through DFF, they are able to hire, give 1-year contracts. Some are even able to contract magnificent buildings. That's the greater autonomy that we would like to see in the facilities. So we have to invest. The facilities go around. Some of the issues, they can be fixed. You do not expect the vehicle from the DHO to travel all the way to a facility which is 54 kilometers away just to deliver blooms. You look at the cost, whereby if the facility has been empowered, they can search for those sweeping blooms from within their locality. So it has got the potential to improve service delivery. The integration, now we are looking at service integration. DFF even has the potential to improve that integration. So we have to support this initiative. And if you look at the facilities, chat with the people, you will realize how now they're able to make those decisions by themselves, the decisions that they wouldn't make before. And because they have the funding, they are able to do that. I'll give you an example of Bangwe. Through DFF, we have managed to open their eyes. They have been able to lobby for resources. They didn't have patients' toilets. Now, construction is starting. That's the dream of DFF. You may not have the funding, but you can also support the facilities to be able to lobby for more funding. But even supporting the facilities directly, trust me, you will see improved healthcare service delivery. Yeah, that's what I can ask other partners, donors, support the cause.